Thanks for staying tuned to AM Live. Richard Forster, Monique Graziadei, and Dr. Rita Kerr. Pleasure to have you on the show.
Good morning.
Fabulous. So you are our new, what's your title?
County Health Officer.
County Health Officer as of October 1st.
I took over on the 1st of October, yes.
Wonderful. Fabulous to have you doing that.
Thank you.
And replacing Dr. Robert Hartman, who did a fabulous job for many years with Amador County.
He has been an excellent mentor to me. He took me around and introduced me to a lot of the people that I need to know and work with within the various other county agencies. And
you have big shoes to fill, literally, because
yes,
Dr. Hartman's like 6'5".
Yes, I have looked down and seen those shoes.
Yeah.
And looked up and seen that experience and knowledge as well.
Wonderful. Tell us, just so we all know, a few of the things that are your responsibility in your position.
Well, as Public Health Officer, I'm appointed by the County Board of Supervisors, and it is a state-mandated office. Every county in the state needs to have a health officer. If you think about it, the United States Surgeon General is kind of the doctor for the country, and then we have a state-level health officer, and then at the local level jurisdiction, each county has a health officer as well to promote and ensure the health and wellness of our citizenry.
So some of the things that you are promoting right now, one would be the flu shot, is that right, and vaccinations?
Definitely. We are just on the cusp of flu season. As of last week, activity of flu was still sporadic in California, so there's still time to get your flu shot.
The flu shot will not help the stomach flu,
Not
right?
the stomach
Okay.
flu. We're
Too
talking
bad.
about the respiratory virus, which can actually be quite serious and even lethal in a susceptible population. Someone who's got underlying respiratory illness like asthma or COPD, or someone who has other immune compromise.
And you want everyone to get the flu shot, but at a minimum, you have more risk populations.
More risk in the very young and the very old, and anyone who has a chronic illness. We've been out to our schools. Every school in the district has already had free flu mist offered to every student that agreed to take it or their parents agreed to have them take it. We've already had our community flu clinic at the health department this past Tuesday, but we continue to offer flu shots the first and third Tuesday of every month. We have a vaccine clinic.
That's
When
good
you
to
get
know.
the flu shot, you should not be around people going through treatments and things like that for a certain amount of time. Like chemo, my brother-in-law is going through chemo right now.
You get recommendation from their personal physician, but in general, if they're very immune compromised, yes, you'd probably want to stay at arm's length or better for a couple of days.
Okay.
Some of the other areas that you cover are motor vehicle safety, safety in the workplace, obviously control of infectious disease, and that brings me to the subject of Ebola.
Before we jump onto that, I just want to say I had the privilege of being able to be part of the teen driver nights that were held at Amador and Argonaut High Schools last week. Ann Lintz from State Farm coordinated those, and we presented to teens and parents about all the risks that are out there, especially with our unforgiving roads here in Amador County. But yes, I will speak a little bit to Ebola.
Before you get there, please talk to the parents too, because I go to work every day and have these parents come up behind me. You can tell because they have young kids with them. They come up right on my bumper, and they're going very fast trying to get their kids to school on time.
Right.
Doesn't do any good if you get an accident.
Definitely, and they really need to think about the behavior that they're modeling for their children who are soon to be driving. So I think that should motivate them as much as anything else to drive responsibly and not be distracted with their cell phone while they're doing it.
Right.
I know, that's so true.
Monique, you asked about Ebola, and this was a really intense time to jump into this position of public health with all that's happening. I think the major thing that we are focused on at this point is preparedness, and we have a lot of very capable people here in the county, staff at public health, staff at the hospital who are very experienced in preparedness and have been doing an excellent job making sure that we have all our systems in place and personal protective equipment acquired and ready to be used and staff trained to use it. And guidance comes down from the national and state level to us. We have resources we can call upon to consult with them. Would we need advice whether someone needs to be restricted in their movement or restricted in contact from other people, or needs to actually be tested for the virus if they have symptoms and have a travel history to an area with contact with people who could have been infected.
How about that 21 days you're supposed to stay inside? A court just overruled that and it ruled in favor of one of the people that was supposed to be quarantined.
On the East Coast, those restriction orders came down as political sort of mandates. In California, the public health department Dr. Ron Chapman is our state health officer, took the scientific recommendations from the Centers for Disease Control and incorporated those into how it would work in California if someone would need to be restricted. There are 4 risk categories. We would individualize each individual's history, symptom complex. We would be monitoring them, usually in a home setting, but if they are not exhibiting symptoms, they are not contagious and they can be in the community.
Okay.
Even though in that 21-day period, they can start showing symptoms.
They can start showing symptoms, but the earliest symptoms are really usually fever or gastrointestinal symptoms. So the minute they start to manifest one of those symptoms, they would be instructed to contact us, and then we could increase the level of restriction if need be.
When are they contagious, though?
Really, the further along in the disease course, the more contagious a person is. And the person who's hospitalized very, very ill is much more contagious than someone who's just starting to develop a fever.
And is it bloodborne, airborne?
Bloodborne and body fluids, not airborne. If you think about it, the gentleman in Texas who unfortunately passed away, all of his household contacts are now beyond the 21-day monitoring period and no one has developed the disease. It's the health workers who were caring for him in his last days when he was very sick and most contagious that were at the highest risk and got exposed.
Okay.
Right,
You want to talk about some of these other groups that
Yes, of course. So safer and healthier foods, that's always important.
Yes, we do get notices of recalls from the state. And if something was to involve a distribution center that affects Amador County, we can get that out there via social media and let people know.
Great,
I
great.
think of an amazing area now. My wife had 2 C-sections. I have a daughter who's had a C-section. What did women do 50 to 100 years ago? They died, I guess, right? Because in most cases?
Fetal and maternal mortality rates have dropped in the past 50 years, definitely. I'm not sure that C-sections is the only reason.
Okay.
There's definitely better health practices, screening for chronic diseases and management of chronic diseases during pregnancy, screening for infectious diseases during pregnancy and management of those as well all contribute to that improvement.
Okay.
And then you also monitor the fluoridation of drinking water. Is that right?
That's something that, as a country, came down as a public health initiative about 30 or 40 years ago now. We don't actively monitor that now, but it is one of those programs where science proved that the rate of dental cavities was lower in those who had fluoridation, and that's how that got started.
Yeah.
And as far as smoking, I just had a friend last night who was smoking a cigarette, and he had major treatment for colon cancer, almost died. And his doc, he said, well, doc told me I could have 2 or 3 a day. As long as I don't smoke a pack, 2 or 3 days, okay. Probably not the best
Not
advice.
the best idea. And when I think about smoking efforts, it's really tough to get a long-term smoker to quit. It's possible, but it's really tough. Where we're really focusing our efforts now is those vulnerable teenagers who might be trying it for the first time. We have an excellent new health educator who really communicates with the teens well, and a great staff of people. We have nurses, epidemiologists, emergency preparedness specialists, as well as health educators at the county health department, and we all work together as a staff to just try and make everyone's health and wellness in this county that much better.
Right, right. Anything else you'd like to tell us before we move on?
I'm grateful to be here. I'm really grateful for this opportunity to use my skills and my education to serve our community, and look forward to meeting lots more people.
And we're thrilled to have you.
Yeah, flu clinics, when are they?
The flu clinics, the immunization clinics, which
immunization.
can include flu vaccine, the afternoons of the first and third Tuesday of the month, and also through your own private physician or clinician's office, or through any of the local pharmacies, you can get a flu shot.
Okay, I think we have to move
Dr.
on.
Rita Kerr here. Thank you so much.
You're welcome.
We're just so pleased to have you in this position.
Thank you.
And we'll be right back. Stay with us.
You're watching Amador County's local